Maggie's Place began as a grassroots movement by 5 young women who had responded to a need in their community, offering support and shelter for pregnant women who are homeless or alone. In a fixed-up bungalow in Phoenix, the first house welcomed 8 pregnant women at a time. Since the year 2000, we've housed and supported more than 600 women and their babies and have grown to 5 houses in Arizona and Ohio. While in the home, mothers are given the opportunity to achieve their goals in a dignified and loving community. In addition, Maggie's Place offers ongoing support for families after they move out. We provide pregnant and parenting women in need the support to achieve their goals. First, we address basic needs like prenatal care, food, and clothing. We also begin the process of healing, responding with dignity, respect, and accountability. Each mother receives emotional support through counseling and the backing of our staff and other mothers. At the same time, she sets goals and works 40 hours each week to meet these goals. With many resources at their fingertips, mothers have obtained their GED or college degree, found employment, and secured affordable housing. By the time they leave, they are better equipped to support their child through taking realistic steps towards independence. Our unique one-on-one approach gives customized care to each mother within the context of a safe, loving community. 100% of these women receive weekly counseling to help them rebuild their lives. Research shows that social support networks are critical for long-term success, so our trained live-in staff is available 24 hours a day to walk with mothers through this transitional period of their lives. And when these mothers are ready to move on independently, they're offered support from our alumni outreach program, allowing them to continue to improve self-sufficiency and to prevent relapse into homelessness. The report on the current status of the homelessness in Arizona said that women with children are the fastest growing subpopulation of people who are homeless. Maggie's Place serves a unique need that few organizations fill, helping mothers break the cycle of poverty specifically at the first stage of parenthood, setting their child up for the greatest chance for success. Our staffing model doesn't just ensure that the mother's basic needs are provided for, but also allows for around-the-clock support in a family environment. We also work with several other organizations to connect moms with scholarships, educational assistance, and job leads. When a mom moves into Maggie's Place, we help her set achievable goals that fall into 15 categories, including employment, savings, daycare, parenting skills, conflict resolution, understanding of self-worth, and so on. As the mother works on these goals each week, for example, enrolling in childbirth classes or interviewing for a job, her progress is tracked, and achievements are often celebrated in the community. In 2013, more than 52% of our guests formally increased their education. When the mother moves out, more analysis is done on data gathered at her intake and exit interviews. Being a faith-based organization, each house is not just a shelter where we sleep and eat, but a place of hope and healing where we recognize the sacredness of each life we encounter, both mother and child. Living under one roof, staff and moms quickly learn what it means to forgive and to love, much like a family. The divide between the rich and poor dissolves in the homes as we learn from one another and establish lasting relationships. Our volunteers and donors benefit from this element of our work as well. Many of our moms leave saying this was the first place where they truly felt loved. After the opening of our first home, it was soon clear that there was a need for another house. To accommodate the great number of pregnant women reaching out to us, we've opened 4 new homes since 2005. In just 13 years, we expanded from housing 8 women to more than 35 women and their infants at any given time. In response to this growth, we're expanding our alumni outreach program. With a newly acquired space, the Mom Training and Outreach Center will provide support to more than 600 families. Our board and leadership have grappled with the question of depth versus breadth. Do we deepen our program to better assist the women currently in our homes, or do we expand our operations to serve a greater population? This question is still in discussion. Since our early days, we have also faced the challenge of staff recruitment and retention. Our in-house staffing model calls for a 1-year volunteer commitment, and we often struggle to fill these positions. Additional resources would allow our community to meet the needs of more pregnant women by expanding our reach to a national scale. Just as importantly, we are also seeking funding to deepen our programs through research and staff retention and development. A larger, better trained team is essential to assisting more mothers. There aren't many other organizations that do what we do. As such, we're often contacted by individuals across the country who want to replicate our housing model. While expansion is certainly an option we hope to pursue, we're also looking to improve our methods of information sharing to groups interested in starting a home independently. By working together and sharing what we know from experience, we can serve more pregnant and parenting women in dire situations across the nation.